In this video, we shall be discussing regarding the embryology of the thyroid development. Now, the main purpose of discussing the embryology of thyroid development is to discuss a few important disorders associated with it, which is your thyroglossal cyst and your lingual thyroid and also your ectopic thyroid. So I have this diagram which I'll come later on. First, let's understand in sequential stepwise manner regarding your embryology or the development of the thyroid. Right. So first what we need to understand is that the thyroid, now it originates from your median thyroid anallage and your lateral thyroid anallage, which have your separate embryonic path and they form your single gland. Right. So now first let's discuss regarding your median thyroid anallage. Now what is the development of your this median thyroid anallage? Now the primitive pharynx, they begin to form the median thyroid anallage at your second week of gestation. Right. Now as they appear as your epithelial proliferation in the floor of pharynx between. So this median thyroid annulus forms at the second week of gestation from the primitive pharynx. Now they appear as your epithelial proliferation in the floor of pharynx between your tuberculum impar and copula, which arises at your second brachial arch. Now what happens is that as it descends, so as it descends to the primitive heart, it becomes bilobed. Right. So it becomes a bilobed diverticulum with a median tubal structure. So this medium tubal structure or the bilobed diverticulum with medium tubal structure becomes solid in your fifth week of gestation. Then they fragment and disappear. Right. Now causing the obliteration, which leaves the foramen cecum at your base of tongue superiorly and pyramidal lobe inferiorly. Right. Now the thyroid continue to descend. I know this line diagram must be getting a little difficult for you to understand, so let me complete this and again I shall be explaining you. Right. So thyroid continue to descend to final position, which is anterior to trachea by 7 week. Now, cells develop from your median thyroid analog to form follicles and produce thyroid hormone by 10th week. Right, so let's again understand. So this median thyroid analog is formed from the primitive pharynx. Right, so it's formed from the primitive pharynx at the second week of gestation. Now they appear as your epithelial proliferation in the floor of pharynx between the tubercular impar and copula arising at the second brachial arm. Now, as they descend down to the primitive heart, it becomes the bilobed diverticulum with a median tubal structure. Now, they become a solid structure by the fifth week of gestation, after which it usually fragments and disappears, and the obliteration leaves foramen secant at the base of the tongue superiorly and pyramidal lobe inferiorly. Now, thyroid continues to descend to the final position anterior to the trachea, which is by 7th week, and the cells develop from this median thyroid analog to form the follicles and which produce the thyroid hormone by 10th week. So, the important point that you need to remember over here is that thyroid hormone responsible is your median thyroid analog. Now, regarding your lateral thyroid analog, right? So, your lateral thyroid analogy. Now, this arises from your pharyngeal endoderm, right? And they fuse to the median thyroid analog at around your fifth week, right? So they comprised from cells of ultimobrachial bodies which originate from fourth and fifth pharyngeal arches. Now, important point to remember over here is that when you talk about ultimobrachial bodies, these are your parafollicular cells which is going to secrete calcitonin. So this calcitonin has a role by your lateral thyroid analog, whereas your thyroid hormone is from your medial thyroid analog. So this is one of the important questions that can be framed from here. Now, the disorders that we were discussing about, so the first one that we would discuss is your thyroglossal cyst. Now, what about your thyroglossal cyst? So, what happens is that the normal development and the obliteration, the normal development and obliteration connected to the hyoid bone start at 7th week. Now, when this duct does not obliterate, so cyst is formed, that is foramen cecum to the thyroid connection, right? So the normal development on obliteration connected to the hyoid bone starts at the 7th week. Now, if this duct does not obliterate, it forms a thyroglossal cyst which connects the foramen cecum to the thyroid, right? Now, how does it present? It usually presents as a painless midline neck mass at or near hyoid and can be present near your base of tongue. So you would be getting a clinical scenario that a 5-year-old or a 7-year-old presents with the midline neck mass. Right now, this midline neck mass moves with the protrusion of the tongue. This is a very important clinical finding that you do in small midline neck swellings in order to differentiate it from your thyroid gland swelling. Right. So this usually presents as a painless midline neck mass. Now another important question that is associated is that one person associated with cancer. Now which is the most common cancer that is associated? It is associated with papillary thyroid carcinoma. Now you need to remember one star mark point, that is medullary thyroid carcinoma generally not associated with your thyroglossal cyst. Now regarding your treatment, so we need to know this procedure name, the famous procedure, which is your cyst trunk procedure. You have direct questions asked from here, like what is this procedure called, which is used in thyroglossal cyst, or cystic cyst trunk procedure is used in which disease. So you need to remember this particular operation name. Now what is this cyst trunk procedure? So what happens over here is excision of the cyst, then duct tract up till the central portion of the hyoid bone. So this is your complete cyst trunk procedure which you need to know. Now apart from your thyroglossal cyst, another important point is your lingual thyroid. Now what is your lingual thyroid? Now this is your failure of descent of median thyroid anillage to descend normally. Right. So lingual thyroid is your failure of descent of median thyroid anillage to descend normally, and sometimes it might only be the thyroid tissue present. So there is no other thyroid tissue, and this could only be the thyroid tissue present. And the third one is your ectopic thyroid, which I have over here. So the ectopic sites of your midline ectopic includes your lingual, sublingual, hyoid bone, infrahyoid, prethyroid, larynx, isthmus, trachea, esophagus, and mediastinal. So these are your some of the common sites depicting your ectopic thyroid masses. Now this is your diagrammatic representation of the development over here on the right side from the median and the left thyroid analogue, which fuses, right, and the formation of the thyroglossal duct, right, where it is forming a cyst because of the failure of not able to obliterate and persistent of the duct, right. So in your embryology, you guys need to remember your median thyroid analogue and the lateral thyroid for calcitonin, medial thyroid for your thyroid hormone synthesis. Then you need to know about your thyroglossal cyst, where your duct does not obliterate and there is a persistent connection between the foramen secant to the thyroid, which is presenting to you as your midline neck masses, has chance 1% of cancer. Most common cancer is your papillary thyroid carcinoma. Cancer that is not found is your medullary thyroid carcinoma, and the treatment is your cyst trunk procedure. And your lingual thyroid, which is the failure of descent of the median thyroid analogue to descend normally. Right, so this were your few important points with respect to your embryology and your thyroglossal cyst. Now one question that you cannot ever miss from this is your cyst trunk procedure, which is done for your thyroglossal cyst, and please do remember that in cyst trunk procedure you do excise your hyoid bone. Thank you.